Hi, Dr. Brent Reynolds here. I'm a chiropractic neurologist. I'm board certified in neurology and as well as neurofeedback. I practice in Smithtown, New York. And I want to talk to you today about concussions and baseline testing for concussions before testing someone who has no symptoms before the concussion happens, and so we can help them after that, getting a normal reading. And so concussions have been in the news a lot lately. They've gone up 16.5% in the past 10 years in student athletes. And it's important to realize that a concussion is a mild traumatic brain injury. They can be severe where the person was rendered unconscious, but most of them happen with little or no contact. You can have a concussion without being hit in the head. Usually there's nausea, vomiting after, headaches, people feel fatigued, a little bit of disorientation. But there's a scope, or there's a range of symptoms that can occur. A lot of times the brain just moves forward and backwards in the skull and causes some damage. Most people, most students, kids who have these recover without any treatment. They just sort of rest and they get back into the sport gradually and hopefully avoid future concussions, because it's usually the second and third one that cause a significant amount of problems. And their research even shows that down the road, Alzheimer's disease, Parkinson's, there may be some connection with previous concussions in adolescence. So it's a really serious problem nowadays, and for everything from soccer, from headshots in soccer, hitting the ball with the head, to football, can cause these things. People having their heads whipped around can cause a concussion. So it's very serious, and we want to have a way to look at the brain's function before a concussion happens. Take a normal picture and see what we see. And so the person has like a snapshot, so that when they have a concussion, if they have a concussion, God forbid they have a concussion, that we can see how much change has happened from what we consider normal or having no symptoms. So there are different ways to take pictures of the brain. You can take an MRI, you can do a CAT scan. These are great. These are spatial pictures. They're very detailed. They show a lot of detail. They show a lot of different the intricacies in the brain. You can tell if there's been, if someone has had a stroke and there's been damage and things like that. They're great. Unfortunately, they do these after people have concussions just to make sure, and they should, and that's all part of the protocol if it's severe enough to do that. But the thing about MRIs and CAT scans is that they show a lot of spatial function. In other words, they show a lot of detail, but they don't show what's called temporal, or over time. They don't show kind of like a reading over time. Even though it takes 30 minutes to do these things, it's pretty much a picture of the brain. We need something to look at the function, because most of the time with concussions, mild concussions, which are mild traumatic brain injuries, there is no structural damage. That you can't see anything wrong with the brain tissue, and so it's all functional. Something's not firing. The person may have fatigue, or they may have depression, or they may have balance problems, and all this is about nerve cells not connecting the way they should prior to the way they did prior to the injury, the concussion. So what we use here in my office is a few things. We do what's called a QEEG, and what that is a reading of the brain waves produced by your brain. A brain wave is basically an electrical signal that can be determined or captured on the scalp, produced by the firing of nerve cells within the brain, and it gives us a very, very detailed picture of a temporal or a time frame over time and what those brain waves are doing. So you should have certain, there's about 4 different brain waves, and they all have a certain size, and they do different functions, and they, it's sort of like shifting gears in a car. You have slow gears and you have fast gears. Well, our brain's the same thing. We have fast brain waves and slow brain waves. And when we take a picture of these brain waves, we can tell which ones are, fast. For example, you should have a little bit faster brain waves in the front of your brain than in the back of your brain. So oftentimes during concussion, people have depression and things like that, or attention problems, because now there's the opposite has happened. We have where there should be fast brain waves in the front, then now slow brain waves, and that can cause problems like personality changes, aggression, anger. People say, I used to not have all these emotional problems before my concussion, and now I do. That's sort of an example of what actually can happen. So how we take this is we do a very specific test called a quantitative EEG. It's different than a EEG you would get in the hospital if you had a seizure disorder or something. That's more of a raw data. They just sort of show normal and abnormal. We take each of the 4 brain waves and we can tell if they are too big, too small, too fast, too slow, and we look at each one of those. We put basically a little swim cap on top of the head like this, and it reads there are 12 different sites, and feeds back to a computer and gives us a snapshot. We have the person with their eyes open and then their eyes closed, and because certain brain waves are more predominant when you close your eyes, you have more your slow brain waves that start to happen are produced more when you close your eyes. If someone, for example, closes their eyes and their brain waves, their fast brain waves increase, they may have problems with insomnia, for example. If people have too many certain brain waves on the left side, left hemisphere, versus the right, they may have depression if there's what we call alpha brain waves in the left hemisphere. So that's just an example of the symptoms that can happen, can come about with a change in brainwave patterns. And the good news is we can actually do something later to train the brain waves. If, for example, they're slow in the front of the brain, we can speed them up through training, and other videos I talk about specifically the training with that. But this really gives us a really good idea of what the person's brain is doing just on a regular day, in the morning preferably, and they just sitting there and maybe focusing on a little dot with the eyes open, and gives us a good idea of just sort of a baseline picture of the brain. And we use that in case there's a concussion that in the future we can look at and see where the changes have been made and where in the brain the changes have occurred. Another thing we do, are part of this, the baseline testing, is we do that, which is the main thing, the QEEG. We also do balance testing with a computerized balance board. We actually have the person stand on a platform, and it reads and tells us how well their balance is for their age group. It sort of gives us an average for their age, and if they're really off, and if they're young and they're 15 years old and they're failing all these balance parameters for their age, it's a problem. We can really see, and we can tell before and after. If they swayed to the left a little bit and now they sway both sides after the concussion, we can tell that they may have more of a vestibular problem, and that just gives us a good idea of how far they've gone off track with that type of thing. We also do a regular neurological examination where I have people follow my finger with their eyes. We track their eyes. We look at eye reflexes. We tap their tendons, make sure we check the strength. We actually check their necks. A lot of times concussions, a lot of the symptoms that people have with headaches and such is actually from injuries to the neck, which often go undiagnosed. And as a chiropractor, we can correct those, especially the upper cervical spine gets twisted and things like that. I had a patient where who was a cheerleader, another cheerleader came down on her head, and she had a lot of headaches and a lot of problems months and months and months after the concussion, and it was actually the injury to her neck which was causing all the symptoms. So this is part of what we do. We have a special right now we're offering, I think it's $100. Typically this would be several $100s for the whole thing, but I really want students to get these baseline tests so we have an idea of how much work they have to do to get back to pre-concussion. and it's really, really important. We want to really help these kids save their brains for the rest of their lives. I mean, you get one brain, and you want to keep it as healthy as possible, as long as you possibly can. Okay? If you have any questions, please call our office at 631-265-1223, and you can find us on the web at newlifechiropractic.com. Okay, take care.